My name is Dr. John Price, Clinical Coordinator here at The Fix in Fort Walton Beach, and I'm going to do a series of videos on blood sugar. Blood sugar is one of those issues that a lot of patients face. It's a metabolic issue, and in our society it is a very, very common problem. And one of the challenges with it is that it affects major parts of the body, and it will totally damage and throw your system out of balance if your blood sugar is not balanced. So the first thing I want you to understand is what normal blood sugar is, how your body is supposed to process this, and what's supposed to be going on. So there's a part of the brain, it's called the hypothalamus. And the hypothalamus is the part of the brain that controls many functions in the body, but one of those is appetite. So one of the things that the hypothalamus picks up on is the level of glucose that the brain is getting, or the level of glucose that the brain has for metabolic function. The brain is actually only between 2 to 5% of our body weight on average, but it burns between 20 and 30% of the calories and the fuel that the body creates. So it's very, very metabolically active. So if your glucose level drops, if the fuel in the body, in the bloodstream, starts to drop that the brain needs, then what will happen is you'll have a normal range, and what will happen is when that glucose starts to come down, the hypothalamus will send out the signal that you're hungry. So then what should happen is you eat, your blood sugar will slowly rise, you'll be satiated, then it comes back down, and then you eat again. So that's a normal cycle of what your body should do, and that's a normal cycle of appetite. What happens with most people, especially patients that we see in our office that are dealing with issues of hormone imbalances, adrenal fatigue, thyroid imbalances, chronic fatigue, all of these chronic conditions, what's very, very common among the majority of them is that through the dietary choices over a long period of time, when they eat, their blood sugar actually goes too high. And they start having hyperglycemic symptoms, or symptoms of hyperglycemia, too much blood sugar. So then, when the body tries to compensate, you'll come down and you actually go too low. So this is a standard response of what will happen in, what the standard American breakfast is. So somebody eats breakfast, they get up, they have some toast, they have some orange juice, and they have a bowl of cereal or some oatmeal or something like that. All these foods, even if it's whole grain toast. So you have whole grain toast, which we're taught to believe is healthy. You eat oatmeal, which we're taught to believe is healthy because it's got fiber and it does all this stuff for us. And then you have orange juice, which we're taught to believe is healthy because it's got a lot of vitamin C in it, which is true. But when you eat those things, once they go into the blood supply, are purely sugar. They convert purely to sugar, so your sugar spikes. When the sugar spikes, then there's nothing there to stabilize it. So as soon as that glucose impulse happens, then it drops again and your sugar crashes. So that's why a lot of people about mid-morning will start getting really fatigued and really tired. So then they go and they have lunch. And so for lunch, they eat something very similar. They eat a sandwich, or they eat something, again, there's a lot of glucose involved. And then they have that crash again at 3 o'clock. So basically, kind of following this kind of pattern. Now, the challenge with this is when this happens, it becomes very damaging to the body. The body becomes very, very inflamed. So if you have any physical injuries, then those injuries will flare up. You'll have a lot more pain. If you have arthritis, you're going to have a lot more pain. Anything in the body that inflammation can affect is going to start getting affected. So this dysglycemic response, even if your labs are normal, a lot of patients will come in and we do their fasting blood sugar, and their blood sugar at a fasting level is within a normal range, but they have this kind of thing going on all day. And all that means is that the body hasn't gotten to the point that this is more the functional response. And again, we do a lot of functional therapy, functional medicine, functional neurology. This is the functional response that's happening in the body, but the body hasn't gone so far in balance yet that they haven't moved into a diabetic state. So even if your glucose levels are normal, your fasting glucose levels are normal, number one, you've got to check your HA1C, because that gives us a better insight into about how your body is handling your blood sugar. Number two, we need to check your lipid panel, your cholesterol, your triglycerides, all of those things, because they tell us how your body is handling blood sugar as well and how the inflammatory response is happening. So if you are dysglycemic, if you're having these ups and downs throughout the day, if you have hypoglycemia, any of these situations, you are in a situation where your body is becoming inflamed. And there's a lot of detriment that comes from that, and I'm going to go over that in the next series, or next few videos. So dysglycemia is huge, okay? And that's very, very important to understand. All right, I'll see you on the next video. So dysglycemia is huge. So we're going to go into this in more detail in the next series of videos. Now, feel free to post a comment below and let me know any subjects you would like me to talk about, anything that you've had questions about that you haven't gotten answers for. I'd be glad to shoot a video. I'm always looking for different ideas of what I can put out there to help educate our community. So please feel free to comment below on this video. Also, feel free to give us any input on other videos that you'd like to see or what you'd like to learn more about. All right, have a great day.